I love this article. This was done in kids, and they measured the dental vibe in kids, 36 patients aged 10 to 17. And they were using the Wong-Baker Faces Pain Rating Scale, which is pretty similar to the visual analog scale that I've already shown you guys. And one of the interesting things for me was mean difference between the groups was 2, which means if, without the dental vibe, the patient rated their pain at 4, well, then with the dental vibe, most people would rate the pain down to 2 now, which is a significant difference. I also like, when we talk about number of patients that reported 0 pain, 17 of the patients reported 0 pain on injection compared to only 3 for control. So they got some great results for the dental vibe, and with the takeaway being that it significantly lowered self-reported pain during local anesthesia injection, and in this case, in adolescent subjects. Looking at another one, and this is one that I really like because I think they did a fantastic study design. And again, they did about 100 patients, 256 injections in split mouth, and their conclusion was there was a significant reduction in pain encountered during local anesthetic injection with the use of the intraoral vibration device, in this case, a dental vibe. But I love how they did it, and I'll walk you through this, is that they did 2 injections. So if you look at inferior alveolar, they actually did 2 injections. They did one with the vibrating device and one without. And they talked to the patients and said, this is what we're going to do, and I'm going to do this injection in your mouth. This is where I'm going to do it. And they asked people to rate how much pain they thought it would cause. And if I highlight it in red, this says this is without vibration, the inferior alveolar nerve block. 5.37 was their anticipated. That's how much they thought it was going to hurt, and actual was 5.26. So they it was pretty close to how much they thought it was going to hurt. Next, they showed those patients the dental vibe, and they said, all right, we're going to do the same injection, but we're going to use this vibrating device. And how much do you think it's going to hurt? Well, even before they did the injection, patients thought it was going to hurt less. And if I highlight in green, it was a lot less. So it was 2.85 now they thought it would hurt. And the actual pain was even lower than that. So this really did significantly reduce pain of injection, but also patients thought it was going to. And so there was, a psychological benefit as well. And this carried through for the infraorbital injection as well as the palatal injection. And all of those injections, they were able to demonstrate that the dental vibe was less painful than using no dental vibe. Here's another study from 2017. I like the way they did this one too, because they used something called the Symptom Severity Index, and you see it there, where patients could sort of check off the box where they thought their pain was from 0 to worst imaginable. And they asked questions like, what was the intensity of your discomfort, or how unpleasant was the injection? How easy was the injection to endure? I like what they did here because they asked just more than just pain, and it was more about the experience of the injection. And again, I'll highlight it in red, but the difference was 4 of those boxes. So again, if it was somewhere in the middle, you could see a 4-box reduction when you used the vibrating device, in this case, the dental vibe. So kind of a really neat way to design a study to not only show that it was good for pain, but also better for the experience. So I really like some of this literature. I think it's kind of interesting the way to design the studies. Any downside to using a dental vibe? Well, a lot of people talk about, if you're going to use your finger to palpate the anatomy and find where to use place the needle for an IA block. If you're holding a dental vibe, that can sort of change that behavior or your technique. And when I've used the device, that's always been the one that I always kind of think of, is that if I can't palpate the anatomy when I'm holding a dental vibe. But I found a workaround for this, and the workaround is that my dental assistant holds the dental vibe. Now I can use my finger to palpate the anatomy, and then I can move, and the dental vibe can go as close to the needle as possible. Or I just try to get the dental assistant to hold it as close as possible, again for 10 to 15 seconds before I insert the needle, and using light pressure on the tissue. So I've been able to work around this and use it. And again, you're seeing is there's those prongs, and there's a light in there. So there's some really cool features with the dental vibe. Here it is a little bit different of a view with the needle actually in tissue. These tips are single use only. I know that the company is working on some additional barriers to prevent cross-contamination. So these are single use tips, and when you put them on, they'll snap on, and when you take them off, actually they rip so that you can't reuse them. which is a fantastic feature, again, to prevent cross-contamination. Moving on to the second one, this is called the Vibroject. It's different. It's instead of a wand that has prongs and a light and those single-use tips, now this is a small vibrating device that hooks onto your syringe, to the barrel of your syringe. I can show you literature on this one as well. Some literature is good and shows a statistical difference. Some literature is bad and shows no benefit. You can kind of find good and bad literature for almost anything. I've just tried to highlight two of them. But one of the things that I wanted to highlight, and I'll give this one a confirmed, or the myth of vibrating devices confirmed. One of the things that the takeaway in looking at the literature is that it's generally positive around vibration, and we know that the gate control theory is proven. So that's why I'm going to say confirmed on this one. But the thing that's most interesting when you look at vibration is that most often, if it's going to be positive, it's going to be two stimuli, meaning it's going to be a vibrating device or a wiggly finger and a painful stimuli, not a vibrating, painful stimuli. And so that's why, for me, the Vibroject isn't my first choice, and I would much rather prefer a vibrating device separate than my painful needle. I'm going to go with the Dental Vibe in this one.